I think you coped amazingly with it all, being stuck in, because Mum really was.
I was in one room.
You were? Yeah, in one room.
For 3 weeks, was it?
Yes.
Yeah.
I think it's really hard for the residents with the masks and the aprons and the gloves and things.
It's a bit restrictive, really, yeah.
Good morning, Suzanne. How are you? I'm fine. You're fine. Are you ready to have a wash? Yes. Super duper.
The day we tested positive, I was surprised I wasn't on the front page of some evening news or something because I was sitting on the beach crying. I think at our worst we had 20 people who we felt were symptomatic. By the time they tested us, there were 7 of them were positive. They refused testing. They kept saying that there was no need and that it wouldn't change what we were doing or the outcome. You ready?
Yeah,
Do you want it out of the bottle or the glass?
in the glass.
In the glass, okay, we'll go for the posh area. Oh, my darling, cheers. I'd have joined you, but they didn't bring me one. Cheers, Colin. This is the residents' garden in St Ronans. We're out here because of the coronavirus and the essential visitors have been stopped from visiting inside. And there's lounges, bedrooms. It's their own home. Hello. Hello. What are we doing?
Got Pat's pampering.
Your toenails look lovely, Pat.
You don't know, have you?
Pretty in pink.
I'm just here with Dennis. Dennis is 120 years old. I'm just pulling your leg, Dennis.
The saddest thing about wearing all this PPE is the fact that your residents don't understand you. They struggle with speech anyhow, so everything's in your eyes. But like Peter's just said to me that he struggles to understand me because I'm wearing a mask. I find that so sad. Big smiley eyes.
Yes.
That's all we can do.
I'm here, love. I'm here. Alright.
I'll ring them and let them know that. At the time it was awful, very stressful and very angry I was. The quality improvement team, the care home teams, they'd all been seconded over to the NHS and gone there. So when we had our outbreak, there was no one to actually help. It felt like at the time, and everything was a bit of a battle. We had 2 deaths from confirmed cases and 2 deaths that I can attribute to it. All of them were allowed visits for end-of-life care. 2 chose not to come in because they were coronavirus positive, so we did video calls. That was really hard. This is my team.
Hello.
Hello. Or some of them, should I say.
It's been a busy day so far.
Yeah. It's always busy. There's always something to do.
How did it feel kind of getting up and coming to work every day at the height of the pandemic?
I felt like I could take on the world. I was like, well, I'm ready.
I think that's what kept me going.
Yeah.
What was your lowest moment?
Probably not being able to see our family members. We had to be careful. We had to be basically in lockdown, not being able to see our sick parents or daughters. We give all our support, but then we can't get support from our family.
How'd it go? Go with the roses behind us.
The sun's in and out, Colin, so
It's what?
it's a bit in and out, the sun. I haven't got PPE on.
Well, I've been locked up because of the government's restriction. So I've been in the building here without any real problem.
And have things got better recently? Can move around a bit more?
Yes, it seems to be on the wane now.
Bless you. I'll just see you. No worries. It's lovely to see you. You come and see me anytime.
We're thinking we're COVID-free at the moment, are we?
Hopefully, according to Public Health England, everybody's done their isolation, so yes.
Mary's happy to see Trix.
Lovely.
I think for me, the hardest thing was I felt like I couldn't do anything.
Dirt.
Yeah?
That's right.
Did you feel that too?
I did.
What's the one thing you're looking forward to being able to do now?
Freedom.
Freedom! Freedom! Yeah.
How's that, my lady?
Fine.
Super. Would you like a cardigan on?
No.
Too long this sector has been underfunded, and our poor residents and our elderly, the way they're treated is wrong. They have the same rights to healthcare as everybody else does, and they should be able to have their retirement years and their last years in luxury and with staff that are well paid. There's sadness, of course there is at times, but mostly it's fun and love, lots of love. Lots of hugs and cuddles normally, and lots of touch. Now it's not quite the same with a pair of gloves on, but hey. But this is like the new normal now, isn't it, for a while?
Yeah.